So today I want to talk a little bit about joint dislocations and what there's some studies that I am going to put in the description, and some things that I thought were really interesting. One is about in-game management of joint dislocations, and they have some cool pictures and x-rays of different dislocations and reducing them. So I thought all that was really interesting. But first, a little bit about joint dislocations. So, joint dislocations happen when bones that form a joint are knocked out of alignment, and so now the joint can't move fluidly anymore, and it causes a lot of pain. Um, at the same time, you could have maybe like pushed some blood vessels or nerves some type of way, so it can be kind of tingling, and some loss of blood flow. So it's really important that sometimes these dislocations we get reduced as fast as possible in the proper clinical setting. So you can have a complete dislocation, and that's where the bone surface are completely separate, or a subluxation where the joints are still partially in contact with each other. So you could think of, if we have our shoulder joint, which is kind of just like a ball on a T, if this were to be pushed completely back, so you're looking at the joint, and the bone gets pushed, back here. So now they're not sitting on each other. That's a dislocation. A subluxation might be you have the top of that bone, and then you kind of have the humerus head still in that space. So for the treatment, we're going to reduce a dislocation. There's a saying that to reduce a dislocation, you need to recreate the injury, which I think is a little confusing, but you can kind of see if the head of your humerus is over here and you need it in this space, you kind of got to pull it back out and put it back, right? So you create traction going out on the bone, and then you kind of are able to put it back here in that space. When how it got injured was maybe some kind of force had, it was sitting here, and some force came and you pushed it, and so with this force then kind of caused the bone to go this way and dislocate, if that kind of makes sense. So that's just what they're saying. We need to recreate the injury, the meaning you need to pull the bone back and create that space, and then kind of, so then like just based on the way things naturally want to pull, it'll pull itself back together, and you can kind of help with the traction on the joint. And also dislocations, tissues, the surrounding affected tissues can take about 6 to 12 weeks to heal, and you are more likely to dislocate a joint if you've previously done it. So if you've already dislocated your shoulder, you're more likely to dislocate your shoulder again. So the study that I was looking at, this was their breakdown. They had almost 19,000 patients, 628 patients presented with dislocations, and 2,081 patients presented with ligamentous or tendinous injuries. So we can see that more males suffer dislocations and ligaments and tendinous injuries. You can think that's just their more men are going to do sports. They're going to do more physical labor. Just so their jobs, they're more likely to injured. And also this study, I believe, was a hospital in Iran. So then you can also think women usually have more traditional jobs in countries like that. So then that would also play a role in that, men are doing more physical activity than women usually typically are in those kind of cultures. So just generally men, if we even think about kids, young boys are more likely to injure themselves than girls, just because, they want to be in the backyard playing with sticks and rocks and whatever. So that also plays a role in that. So the most common and least common dislocations they saw was the shoulder, with almost 50% of dislocations being the shoulder, This is really common. Other studies can support that the shoulder is the most commonly dislocated joint. Then we saw fingers, toes, hips, elbows, and then the most common to the least common ligament and tendinous injuries we could see was the ankle, the midfoot, the knee, the hand, and then the shoulder. So the shoulder was the least likely to have a ligament or tendinous injury, but it not be dislocated, right? So dislocations can cause these kind of injuries to the joint, but it's uncommon. Like, it's uncommon that you would see a shoulder with just a ligamentous or tendinous injury and not be dislocated. So that's kind of why dislocations at the bottom of the list here and at the top of the list here. So this study, they used patient data with a diagnosis of a pure dislocation or ligament and tendon injuries. So this means that they didn't use patients with fractures, lacerations, and basic soft tissue injuries. So this matters because most ankle dislocations happen with a fracture of something in the ankle. There's a lot of little bones in the ankle, so a lot of them can be broken. So that's why the shoulder was the most commonly dislocated instead of, say, the ankle, because we didn't count dislocations that include fractures. And so some studies also show that the ankle sprain is the most common injury to see in the ERs, and so about half of ankle sprains happen during sports activities. And so the group that suffered from the most dislocations were males ages 21 to 25, and also the most tendinous and ligamentous injuries. So honestly, we're just thinking young males, and young women too. Young women were also most likely to suffer injuries. We did, the ratios were 4.2 for dislocations and 1.7 for tendon and ligament injuries. You can kind of think of this as, for every 4.2 guys that dislocated something, one woman dislocated something. And same thing with our ligament and tendon injuries. For every 1.7 guys who injured a tendon or a ligament, one woman injured a tendon or a ligament. And so we usually see these injuries in young demographics, who can play sports. But also we did see some elderly patients, with those hip dislocations, shoulder, whatever it is. But it's important to note that usually, like with sports, those are contact injuries, forces being applied to the body. With older demographics getting injured, that's more so because they can, as you age, you lose muscle if you didn't have it. So it can be really hard to keep your bones and things in place when the muscles aren't strong, the ligaments aren't strong. We're not putting anything under a load, so it doesn't, you're not training that to be able to withstand any kind of force. So, old people can just fall over and, they can break something, they can dislocate something. Whereas a fall from just, getting up from a chair would usually be fine. For a younger person, you might be a little bit sore, but older individuals can fall back and dislocate and break things. So that's really why we see that in those demographics, just because they're not training. So just really important to make sure as you get older, you keep putting your body under load, you keep exercising, and you keep up your muscle mass, so when you're older you can be able to handle injuries like that. So I also want to talk about a limitation on this study, and it's that there's no national registry system for trauma injuries. And so basically what they're saying is you'd have to go to an individual hospital and say, hey, I want y'all to record this data for me. But there is no national database that every hospital can submit to and say, hey, today we had 30 ankle sprains, we had, 10 trauma accidents, we had, and I can see how this makes sense, because most hospital systems don't talk to each other. And so if you're going to one hospital system, for example, like Memorial Hermann, that's not going to talk to something like St. Joseph's Hospital because they're not in the same system. At the end of the day, it's a business, and so they're not data sharing like that. But just something interesting that I'm starting to see, in medicine, there's not a lot of national registries, and I can understand how that's difficult to implement because of HIPAA and all those things. I mean, obviously with this, your patient can just be a number, and I saw so many people today with ankle sprains. But just something interesting that, maybe it would help researchers and clinicians with some of these things if we knew how many ankle sprains happened every day, if we had a reliable source for that data. Anyway, so yeah, so I hope that was helpful. I thought it was just really interesting, and thank you for listening.